Behind New York and New Jersey, Massachusetts now has the third highest number of confirmed COVID-19 cases. White House Coronavirus Task Force Response Coordinator Dr. Deborah Birx referred to the high rates of infection in the state on Face the Nation this weekend, and Governor Charlie Baker says we are currently in the middle of the surge with more than 39,000 cases. I spoke with Dr. Robert Roose, the Chief Medical Officer of Mercy Medical Center in Springfield, to find out more.
Developing a response to the coronavirus pandemic has been something that has been very unprecedented. Here at Mercy Medical Center, I've had the privilege of serving as the incident commander for our emergency response to COVID-19, and we've been tracking this information on a daily basis. At the moment at Mercy Medical Center, we remain in a phase of this pandemic, one that is stable and one in which we've started to see the number of cases of hospitalized patients and those in our intensive care units go down slowly over the course of the last 10 to 14 days. We actually saw our peak of hospitalized and intensive care patients the first week of April and have since then been starting to see that plateau and slowly decrease over the last few weeks.
Would you say that's consistent in Hampden County as that was being reported of a plateau last week from Bay State as well?
It is. One of the great things that has come out of this pandemic is the increased collaboration and alignment amongst all the hospitals here in the Pioneer Valley. And we have regular communication with all of our hospitals, as well as the hospitals as part of Trinity Health of New England in Connecticut. And the hospitals here in Western Massachusetts have all been seeing the same thing, where we peaked a little over a week ago and have started to see those cases decrease since then.
Now, I know that we are in the midst of the peak or surge, I should say, statewide. And obviously, there's a lot of attention on Massachusetts now as really the number 3 state for the most COVID-19 confirmed cases. Obviously, that's still a concern.
Of course it is. When we set out to ensure that we were prepared as a health system and as a community, we wanted to make sure that we were ready at the moment and when the virus started to come into Hampden County, but also that we would be ready for anything. And we developed, very elaborate, detailed surge plans that actually created capacity within our hospital to increase our ICU by 3-fold and double the number of medical surgical beds in our hospital so that we would have increased our volume here by over 120 beds. What we're seeing now is that our capacity in the hospital is only about, our occupancy, I should say, is only about 40 to 50% of what our total maximum capacity could be. So we have plenty of additional capacity that we could utilize if this were to change at some moment. That's been very similar with other hospitals in the region. And so we're feeling cautious but optimistic with great reason for hope that we are at a point in this pandemic where we can start to address some of the ongoing mitigation to look at the future of how we can continue to provide care.
When you talk about ongoing mitigation, I think a lot of people are concerned that once we're out of this, that this all repeats again in October through the winter. I mean, obviously you're having conversations about how we re-enter our normal life. What is that going to look like?
Yeah, so you're bringing up some really important points. One thing that I do want to highlight for the community is that even through this pandemic, hospitals like Mercy and others in our region have remained open and ready to care for any conditions. We take care of patients every day that come to our hospital with abdominal pain, with stroke. We take care of patients with cancer. We see moms who are coming to deliver a baby. And all of that is done safely and effectively and separate from the areas where we take care of patients that could potentially have or do have COVID-19. So when we start to think about that phase now that we are approaching, that I have been calling a slow COVID phase, one in which we know that there will be continued infections for months, possibly even beyond, but where we have a system where the community knows and can trust that hospitals are safe places to be, that we can take care of all of their needs. What that is really going to be based on is the availability of testing, the ability to identify any hotspots in the community where new infections might be coming up so we can tamp those down immediately, and the availability within our facilities and workforce to ensure that we have parallel tracks where we can care for patients with COVID and those without. That's what we're working on and really have already developed an expertise here at Mercy to ensure that the community knows that they can continue to come for us for care now and well into the future.
And when you're talking about those hotspots, you're talking about densely populated areas, obviously urban areas, and also nursing homes as well?
Yes, those are some of the highest risk areas. Certainly, we know that this infection has disproportionately impacted elders. Looking at the data that the Massachusetts Department of Health published last night, you can see that the case rate, the number of infections per 100,000 individuals, is disproportionately impacting those over 80 years old. And that has followed similarly with the numbers and the rates of individuals that have died from this disease. We know that that is because congregate settings like long-term care facilities, skilled nursing facilities, can sometimes be areas where an infection like this can spread very quickly if it's not identified and proper procedures are not put into place, or in some cases, even if they are. And so we are engaged in efforts to ensure that we're communicating with those facilities, providing support with medical advice and with infection control procedures to ensure that we get a handle on anything that might pop up at any moment. In addition to partnering with the city of Springfield to ensure that we test our homeless population and those that are undomiciled, as they also are at risk and can be in congregate settings where infections could spread quickly if it's not carefully monitored.
And there is a facility outside the homeless shelter in Springfield that is currently set up now, correct?
There is. It's been a tremendous partnership on behalf of the city of Springfield, and I want to give great gratitude for the leadership of Commissioner Helen Carlton-Harris and that whole team here in the city of Springfield, as well as with the Friends of the Homeless and Mercy's Healthcare for the Homeless. And many of our providers are on site providing nursing and medical care to ensure that the patients are quarantined as appropriate, cared for when needed, and we're moving towards an effort to ensure that everybody gets tested.
Can you talk a little bit about some of the drugs that are out there? One in particular that has had a little bit of controversy, the anti-malaria drug, hydrochloroquine, how it is used, if it's being used in Massachusetts, and how effective it could be.
Yeah, so one important thing to know about this disease right now is that there are no specifically proven treatments that have a robust amount of evidence that can say that this is the definitive treatment that can help somebody, either reverse their complications or be cured. That does not exist. There are several types of treatments. Hydroxychloroquine is one of them that are currently undergoing trial to evaluate their effectiveness. Because of some early data, there are providers, and here at Mercy and throughout Trinity Health, there is a recommendation that we do use hydroxychloroquine in certain patients that have moderate to severe disease, particularly those that would be approaching or maybe end up on mechanical ventilation. But right now, that science is constantly evolving, so we're staying on top of the latest evidence to ensure that our treatments are the most focused for what we think can work. Here in New England, Trinity Health of New England has also been one of just a select hospital systems throughout the country, one of just 4, including Mayo Clinic and Johns Hopkins, actually, that got the approval through the FDA to do a clinical trial studying the use of convalescent plasma. And that's an exciting opportunity for us, not only provide this option to a select few patients, but also to contribute to that growing evidence base to see what really will work, so that we know what's the best treatment to use now, and also if this disease continues into the future.
Tell me a little bit about the antibody testing and how helpful that will be as we move out into these next phases where we restart the economy.
So generally speaking, when we're looking at infections like this, antibody testing can be very useful if we have an appropriate test that has been shown to be both safe and effective, so that we are able to utilize it in the ways in which we normally would. Antibodies can often be a sign that somebody has had an infection and now has developed immunity or protection against an infection like a virus. However, right now, there are few antibody tests that are available, and the ones that are available have not yet shown to the level of science and rigor that we typically demand their sensitivity and specificity to be able to identify all the individuals that have had the infection. And then we also don't yet know what exactly having antibodies to the SARS-CoV-2 virus really means in terms of protection. This virus is just so new that we don't yet have the ability to have tracked people over time and really test and see if those antibodies confer protection or not. And so at this time, the antibody testing is a little bit premature in terms of not quite being ready for prime time. But when it is ready and there's good, reliable tests, I think it can hold significant value.
I know you're also an expert in the field of substance use disorder, and you've done so much work in Massachusetts on that. In this period of isolation, obviously that's still on your radar and the radar of others. What is the impact?
Yeah, this is a big, personal passion and concern of mine. When thinking about these two pandemics, I've been a provider on the front lines of the opiate epidemic, and it's one that has come with great uncertainty, tragedy, and loss, and in some ways not dissimilar from what we're experiencing with COVID, where it's impacting all aspects of society, and it's really going to take an effort on behalf of everyone working together to ensure that we address it in the appropriate way. Specifically in regards to substance use disorders, we know that addiction can often be a disease of a loss of connection. And people can feel isolated, and that can sometimes lead to exacerbations or increases in use or even risk for overdose. What the COVID pandemic has layered on is now we are encouraging people, to have to connect in different ways that does not involve that typical close, face-to-face encounter. So what that's required of us, treating patients for addiction is to ensure that we modify our communication approaches and we develop ways to connect like this through an audio video chat, ways that we can ensure that people are being monitored and looked after, and ensuring that our programs stay open and transform the way that they operate to ensure that people can get the care that they need. We've seen that throughout Western Massachusetts. We've done that in our programs at Providence Hospital. And I think that's essential if we're going to continue to care for our community, and particularly those that are struggling from things like addiction during this time.